Hello.
Hello, Dr. Pradeep.
So this is Mr. Ramesh Ratnakar. He hails from Delhi. He is here for the past 30 odd days.
Right.
Yeah,
I spent 4 weeks here.
yeah, 4 weeks here. And sir, please tell your experience about our hospital.
I suppose this is a kind of testimonial we are doing.
Yes.
So I'll be very objective, very fair, because I don't want to give any false hopes.
Yes.
And yet I want to be fair to this remarkable institution that you have created. So let me start off very objectively, covering each little areas which anybody who is interested in coming would want to know about. For
Yes.
example, food, for example, services, for example, facilities, and of course the medical side of it. And last but not least, I'll talk about my personal experience and what I have gained and what I am taking away from here. The biggest, perhaps the strongest attractive part of this institution is the staff and the general administrative personnel who work here, the cleaning staff, the service people. They are not trained. They are not trained by specialists and so on. And thank God for that. Because they don't have plastic smiles and praxis gestures. They are intensely human and very empathetic. Your pain becomes their pain and your joy becomes their joy. And they set the tone and they create the atmosphere of the place. So that's a wonderful thing. As far as infrastructure is concerned, well, a lot needs to be done, but they are working on it and they will, I suppose, in time improve as they go along. For example, the dining area is very sort of loose and open, and I'm sure some work can be done. Sports facilities, physiotherapy facilities, these can be improved upon. The doctors, they are knowledgeable, professional, and they are onto an adventure in a certain sense, the way I put it, because they have created a medical practice and a medical way of attacking Parkinson, which is very innovative and which I find very exciting and which has benefited me a lot. What they are practicing, as I understand it now after conversation with Dr. Pradeep, is what he calls integrated medicine. He is trying to focus on the patient and healing rather than worry about the specializations and divisions in the medical sort of terminology or history. So it's not as if allopathic or homeopathic is sort of stylely looked upon here. Anything and everything goes as far as it's helping you in your understanding of your body, and then he will pitch in and take care of your problems, and he'll be an ally and a friend, and he'll force you to set your agendas. He will not be the sort of a doctor who is telling you to do things like this, but he'll ask you to think about what you're doing, why you're doing it, and then sort of take it up from there and build the practice up. And that's why it's very important to stay for a longish time here. Because if you try to just come and do something quickly and go away, then the whole process doesn't take off as effectively as it should. Because I was interested in getting out fast to begin with. But then I realized the way that things are unfolding, I better stay on, because then I will get the maximum benefit out of it. Speaking personally, Puttur and Dr. Pradeep Kumar's Ayurvedic hospital has given me many Houston moments with time. Moments where one felt one is racing against destiny itself. After all, I inherited my Parkinson. I have been suffering from it for the last 8-10 years, and it seemed as if destiny itself had imposed it upon me. And though I have been pretty successful in holding it back, as it were, through my sports and my sort of exercising and allopathic neurologists and so on, some of the best in Delhi. I was basically working with AIIMS neurological department, and former head of the department, Dr. Bihari, is my neurologist. But before coming here, I was in a pretty desperate situation. I was filled with dread and I was filled with fear, because the allopathic medicines were not having the same effect that they were having earlier. I could feel it in my body. I could feel that the thing that I was doing, I would not be able to do for much longer. And that fear was driving me to look for other resources, other ways of handling it. And then I heard of this establishment and I made a beeline for it because what was promised and what many of the videos spoke about, he was not talking so much of curing Parkinson as managing Parkinson. The idea was to reduce the tablets and the idea is to be more effective in dealing with Parkinson. And when I heard this sort of thread running in the videos that were there on the YouTube, I immediately decided I'm going to come here. And after coming here now, after I was on 8 or 9 Syndicoclus, now I'm on 4. And more than that, what I have been able to get rid of is the fear of Parkinson. I know now that there are alternative ways of doing things, there are better ways of doing things, that allopathy is not the only way to handle Parkinson. And I know now that I can live the kind of life that I want to till as long as I am alive. So thank you very much, Dr. Budi. Off for a walk in Puttur Tree Park. Come, let's go.